science, but that can give some clues, because truly, if you choose the wrong class of medication and you spend 2 months getting it up to an adequate dose and they don't get there, if you shoot at the wrong target, then you got to start all over again, and you've lost 2, 3, 4 months. Yes, sir.
Just a question. Most of us are not prescribing clinicians. How do we deal with this relative to our clients without overstepping our bounds?
Okay, this is an excellent question. I'm really glad. Thank you for bringing that up. First off, I think the scene's changed a lot in the last 25 years. Primary care doctors being much more open to our consulting with them and offering our opinions. So, for instance, if someone came to me and they said, well, I thought I better come see a therapist. My doctor's got me on Prozac, or it could be another SSRI, but this person has an anergic depression. They can't even get out of bed. They're high apathetic. I would be inclined to ask their permission to talk to their doctor, and these are the kind of words I use when talking to primary care doctors. And I say, my name's Dr. Preston. We have a patient that we share in common, and I know that you've diagnosed major depression or using Prozac, and I completely agree with the diagnosis. I think it's right on target. However, I wanted to mention something. I've done an evaluation on this man, and because he has marked apathy, indifference, he's lethargic, he's anergic. I want to mention several things there. As you probably know, drugs like Wellbutrin oftentimes are more effective at dealing with that subtype of depression, and I'd like to know what you think about possibly changing him to Wellbutrin. As you may know, drugs like, somehow that seems to be persuasive. And the thing is, we've got to use common human decency, but also our own clinical judgment about how to be very respectful about that. But in medicine, all over the place, primary care doctors call up cardiologists and ask them their opinions and that sort of thing. So I don't think I could, in good conscience, sit there with a guy who hasn't responded to Prozac. He doesn't have the kind of classic symptoms that are likely to be highly responsive. What am I going to sit there and say nothing when I know a switch of drugs may be in order? So I would tell my patient I'd like to just discuss the issue of medication with the doctor and see how open they are. And I will tell you, with maybe one exception in the last 10 years, every single primary care doctor I've talked to has said, sure, that's fine, let's give it a shot. Let's give it a shot. Now, I don't advise people doing that unless you feel confident, in your ability to know what you're talking about and that sort of thing. But I think that we're advocates for our patients. And again, this is not a criticism of primary care docs, but they don't know some of this stuff, and so I've got to overcome some of my own uneasiness about treading on maybe what sometimes feels like thin ice on behalf of my patients, and I think it's okay for us to do that. Okay.